session where we're going to be looking at patient care strategies, and Julie's going to be focused on the emotional aspects and strategies and treatments, and Dr. Michael Cohn will be focused more on the technology. So, Julie, first, what role can a healthcare professional play in addressing the emotional impacts of urinary incontinence on their patients?
Well, there are so many things that these professionals can do. I think that the first step is just to begin with open and honest communication about the fact that this is a problem. You are not alone. Here are things we can do. And even just the simple question of, are you experiencing urinary incontinence? I think that is something that is just not addressed. I mean, I had my first child 11 and a half years ago, and it wasn't the dark ages. It was in New York City at a prestigious hospital, and yet I had no idea about it because nobody had discussed that aspect of postpartum care. And so, these are the questions, the statements, the concerns. Let's preemptively address it and get them to begin these conversations. Holistic care, we don't need to jump to the most aggressive treatment. We can start with a conservative treatment and just seeing and getting the patient buy-in so that they can see what they can do in order to change and help. And maybe an aggressive treatment is needed, but the patient can help their recovery and such along the way if they are able to participate in it. And just the understanding of incontinence can help with the treatment, and therefore we're going to have more compliance with their treatment if they have the buy-in. So with us recognizing their emotional needs and their willingness to participate in their recovery and in their care can then dictate the path that can be taken in terms of how we can help them. Um, and I just think it's important to also know the actual problem as to what is causing the incontinence, because we can put a band-aid on it. We can just give them a medication or we can do a surgery, but that doesn't always uh, alleviate the actual problem within itself. Um, so I also know, and it has been shown, that if we can address this early, and why wait until it is a huge problem for the person, if we can address it early through this communication and just bring their awareness to it, we can reduce healthcare costs, which is also boggling in my mind. Like, it boggles my mind how we are going to as a society wait until the problem is so bad that we are paying these huge healthcare bills in order to fix it. But it is something that probably could have been addressed and solved with, I mean, a quarter of the cost needed. So we could just really do so much in that area. And then finally, I think it's really important that we can offer support to caregivers, as we know that it does not just, it affects the person along the spectrum of their lifespan. And since not everybody has had the same awareness of incontinence, now a lot of it may fall on the caregiver because, like, as Dr. Cohn said, as a person ages and it becomes more and more prevalent, um, and also a reason for admittance to nursing homes and such, if we are giving the support to the caregivers and showing them what they can do and how they can help, we really could improve a person's just emotional well-being, their support, their mental health in terms of it. I mean, because we know that everything and all of this will suffer due to just due to incontinence.
Thank you so much for that. Really important. I really like that you added the aspect of support for caregivers in there because, again, you've highlighted many different points and leaving them out would have been an oversight. So thank you for including that. Let's move on to strategies in terms of education, Julie. Are there any particular patient education strategies that have been shown to be effective in changing the social perceptions or even reducing stigma associated with urinary incontinence?
So there have definitely been a bunch. Just starting with the education materials, a comprehensive, just trying to make sure that the patient is getting it through a multimodality system so they can feel it, they can hear it, they can see it. They are getting handouts, they are getting videos, they are discussing it, they are able to take a larger role within it as they begin to understand. They're able to take a larger role within their recovery and within their treatment planning if they are able to understand the problem and how they can fix it and then getting their buy-in. So, if we can do all this, I mean, as therapists, I know a bunch of us will just take the patient's phone and help make videos on their phone so they can see what they can do. And, we know that there are steps that are needed to take in order to have a person truly integrate the information. So we can have them, repeat it, practice it, and such in front of us so that we know that they understand. And then having the buy in where they can see it as, they know that they had already learned it. So when they watch the video, they will know that they've already learned it and they can continue along the way. Which is why using these digital platforms, I mean, I know technology has made such wonderful advances. Sometimes I feel like I need a teenager to translate all of the technology and, all of this social media stuff that is going on. But there is so much information on the internet and through social media that we can learn, we can see. And yes, it's important to tease out the ones that we can actually trust versus, Dr. Google kind of thing. Um, However, finding the correct stuff, finding peer support and such, not just through the social media, but finding other people. What if we created groups that people could come together and share their strategies and just begin to find a camaraderie with amongst other people and within themselves so that they can reduce the isolation and, combating these negative stereotypes that arise solely because here they are experiencing incontinence and thinking that how could that happen to me? um, and what if it was included in education? What if it was discussed throughout the person's lifespan, starting from sex ed as a kid, here are things that you can do to make sure that your pelvic floor is strong, and it's not always just Kegels. It could be anything. And then, as we go along the way, when you're postpartum, this is what you should do. When you're in pregnancy, this is what you should do. And then middle age, as you lose the hormones, and here are other avenues that you can take in order to uh, just get to that and fix and just preemptively discuss and learn about it. So including it in education would be so beneficial for everybody because again, why wait until there's a problem? Let's address it beforehand and maybe we can tease out the situations that could have been handled previously and then finally let's just create campaigns about it, all these social and advocacy campaigns. There are so many now, there are groups that work and they fight for all these things and advocate for it. So let's advocate for ending the negative social stigma, ending the unnecessary incontinence. I mean, there's so many avenues that we can take in order to just take a role. And as healthcare providers, I feel like we're in this amazing place where we can uniquely handle it and address it. So hopefully we can start making these huge gains.
Wonderful. Thank you so much for that. Great contributions in terms of the psychological, the educational. We're going to build on that. And Dr. Michael Cohn's going to contribute a little bit here. So, Dr. Cohn, you have a very unique perspective as a multinational CEO. In your experience, has culture affected the acceptance of new technologies and treatments related to urinary incontinence?
When you were saying that, as a Swede working with an Israeli company with an US team, introducing it in different cultures, we can clearly see that there is impact, cultural impact. Um, especially maybe in the States or in the Anglo, which is a very Puritan culture. So um, the it's very hard even to have nurses and patients talk about the area, the genital area. And we met introducing it even to in hospitals where nurses were saying, I don't want to clean down there. I don't want to deal with that. I don't want to try the device, they feel uncomfortable. It seems like they're very, very embarrassed to deal with it. And the genital area is, we need it. It's something, we give birth. But when it comes to taking care of it, it seems to be a threshold here, which is a little specific for I think the US, some of the US market. Maybe it's also with the white Puritan heritage here, which we don't maybe have in the Black or Hispanic. You can discuss these kind of issues, but definitely that's a threshold to implementing, evaluating, getting compliance with the new strategies. And with these strategies, just one thing is that people don't know about it, but there is a resistance to deal with it from a cultural perspective. So I think TV, media, having famous people talk about it in the US as, we need to deal with this. This is nothing to be, in Sweden, people have a sauna, they're naked together, not a big deal. My wife is American. We had a baby on the beach, and the baby was naked, and I got reproached from her. What's your baby? You're naked on the street, on the beach. You have to put something on. That's how bad it is. So, with that kind of perspective, I'm not surprised that we have a problem here in the U.S. And we need to have webinars like this to talk about it.
And that's definitely one of the goals of today. Absolutely.
Yeah.
Thank you. Well, let's build on that a little bit. What are some examples of how new technologies have improved patient outcomes?
Yeah, there definitely been a lot of new technologies coming out here because it is a big problem. When we look at pharmacological treatment, take a pill. It's the easiest one. We have urge. You have alpha receptor agonists that can decrease the contractions. You can, because of menopause, you can use local estrogen hormones to make the mucous membranes less sensitive. You even have botulinus injections, like a neurotoxin that can decrease the urge. You can inject it into the bladder. You have antimuscarinic and other neuromodulator substances. They also have side effects because they affect the brain. They affect other parts of the body because it affects all the neural system. And so those that there has been some, you can take those, they are not permanent. If it works, it works, but you have to be looking out for interactions with other substances that you might take for other conditions you have. So you have to look at the the side effects from that. There are also some little more invasive technologies. We had sling operations where you lift the urethra to have it close easier, been very popular the past 20 years. People have been pretty good results from that, but over time we've seen now that they are incontinent again, and there is no way to deal with it. It becomes a really chronic condition. So be aware of the long term. They're usually, the studies I've seen have very good, sometimes short-term data, but ask your doctor about the long-term data too before you would make an invasive procedure. So that's invasive. We've seen some improvement in the diaper, in the pads. They're more absorbent, meaning you don't have to change them that much often. So you lay in them longer time, which we talked about the pH before, might not be very good for the skin. And there's also sustainability issue with pads and adult diapers. They take a huge amount of energy, and you have to throw them out in garbage and discard them. So it has a load on the environment. But um, um, and you have also technology like implantable electrodes or wearables where you use electronic stimulation to control the nerves, and that's sometimes less invasive. You don't change the anatomy and anything, and might be something to try. And the past years, also a number of external devices. We have in the US and the hospitals a lot of suction-based devices that you use, and we developed a non-suction external device that is uniquely suitable for nighttime incontinence. Doesn't use any suction or glue, and that's new in the market, and we are introducing it. We think it is a great option for many nighttime incontinent people, patients, women. And one of our distributors here in Sweden, they innovated also an external silicone-based device for stress incontinence, that you just insert. You can take it out, and it, instead of having an invasive, it just pushes a little on the urethra to position it right, so you don't have that when you cough or something, you have that release of urine that you don't want. So that's not introduced in the US market yet, but it's in the European market, in UK and Sweden. Hopefully we can introduce it also in the US. So here you have development on all levels, and it's needed because of the frequency and the big load on the healthcare system, on the individual, that we need to develop all these technologies, and we need to have evaluate them and have the healthcare system adopt them and look at the actual outcome of how to use it. And you probably need to combine some of them and change over time which one you use, which is suited to you and your condition. So that's a kind of an overview over, pharmacological, electronic stimulation, external devices that actually is available on the market.
Thank you for sharing. That's a nice overview on a broad range of products. Do you have advice for healthcare providers who might be considering an exploration of different technologies for their patients?
Yeah, they should. First of all, you should talk about incontinence with your patients. Anamnesis is the most important thing. I learned that as a doctor, and I use that technology in all my life. Ask questions. What's going on? What's the background? Also, you're going to treat an incontinent patient for high blood pressure with a diuretic. You're going to have a disaster. So you better know beforehand that this is the case. So you have to ask that, and how it affects them, and is there a background here? So I think that's the first, and I think medical doctors, incontinent, if you can't operate on it, they're not that interested. Surgeons, urologists are actually the ones that are responsible for it, and and they like to operate. So if it's not invasive, not so interesting. So pelvic nurses like Julia, or physiotherapists in other countries, or urology nurses, they are probably a better partner. And I think we need to train the nurse population in how to deal with incontinence. Um, so I think that's where you have to adopt. That's who you have to address to adopt new things. And there should be protocols, there should be evaluation, and there should be time. And in the general crisis in the hospital system, this is a huge challenge because nurses are striking, underpaid. There are nurses for hire. There is no routine. How are you going to make a study if you don't have consistency in the healthcare system, people who are in one place and they know what protocols to use and so on? And I think if the healthcare system is not going to deal with that method of improving care and evaluating new devices that I mentioned many of them, it's going to cost more. We're going to just have a higher and higher healthcare cost, and higher. We have a baby boomer now. We have, the generation just above my generation. It's gigantic. It's going to just cost a lot of money. So that's my advice. There are methods for this, but if you don't have the underlying organization for it, it's not going to happen.
Wonderful. Thank you for those hints. So that really wraps up the second section of today's webinar, where we've discussed patient care strategies with a focus on education and technology that also incorporates the aspects of emotional care. But let's do the final and third section of today's webinar, where we're just going to do a little short, quick, rapid answer to the same question for both of you. So Michael, first, in your experience, what are some of the most common misconceptions about urinary incontinence among patients and or healthcare professionals? And then Julie will answer that same question.